Break down the findings.
Oh, it's wild. This is the largest study ever done for the prevention of melanoma. So close to 60,000 women 50 and older, and what it showed is if you took aspirin up to 5 years, a 30% reduction in melanoma. It went up, the reduction, the longer you took it. So pretty dramatic, and aspirin a day has dramatic powers.
Well, how does it work?
Well, this is a drug that 2,400 years ago, Hippocrates told of taking the bark of the willow tree, chewing it, and you'll reduce pain and fever. And so this drug has been around for a long time. And aspirin a day seems to reduce inflammation. Inflammation is at the root of diseases like heart disease and cancer. So what you've seen is really over the last several years, study after study, showing a benefit of aspirin. And aspirin a day in several studies reduced overall the death rate of cancer by close to 30%. And this is the first study on melanoma. There have been data going both ways that were smaller, and now clearly the definitive study shows that an aspirin a day in women over 50 has a dramatic effect. That doesn't mean it doesn't work in men or in women under 50, but this was whom the study was done in.
Are there any side effects?
No question about it. Right now, aspirin is a remarkable drug, but I want everyone to discuss it with their doctor because it can upset the stomach and it can cause some bleeding. That being said, for $3.50 a year, a pill a day can have a dramatic effect in terms of lowering both these diseases. The big question is, why aren't more people taking it? Why aren't doctors talking about it always with patients? Because this preventive strategy, depending on your history, is key to long-term health. And this observation that this drug that's over 2,000 years old will lower the incidence of cancer is really profound. And so the next question is, how are we going to make it better? How are we going to get rid of those side effects so we can all take it without worrying about it?
And doctor, you say in addition to making all of us healthier, this could also save a lot of money, right?
Well, listen, diseases like heart disease and cancer are why our healthcare costs are out of control. We're spending a tremendous amount on those diseases. The more we can prevent them, the long run, how we're going to do much, much better. So when we look at this, spending a couple dollars a year prevention, that's where we have to put the focus. And I want people to go to the doctor and ask the question, why aren't I on an aspirin? And for many people, it's not the right drug. But for many people, if not most, it really can have a dramatic effect on health, especially if you're 50 years of age and older.
Very interesting findings, and as always, great to see you, Dr. Agus.
Oh, thank you guys. I appreciate it.
And it is time now.